At this point, I do wish to announce that as of this morning, the numbers of people who have confirmed positive has risen to 24. And this, I think it must be clear, we announced 16, and I'm sure the members would recall that we had one which I said we need to remove from the count because on confirmation, we actually feel that that one was found to be negative. So from that point of view, we're moving from 16, and then there are 8 new patients. So if I can just quickly go through those, Gauteng has got 4 of those patients. It's a 39-year-old female who had traveled to Switzerland and Austria. There's a 50-year-old male who had traveled to Austria. There's a 21-year-old female who had traveled to Italy. A 57-year-old male who had traveled to Switzerland. Then in KwaZulu-Natal, we're reporting 2 new people who have tested positive. One is a 79-year-old male who had traveled to Greece and Italy. Then a 52-year-old male who had traveled to Switzerland. In the Western Cape, we've got 2, and here there's a 50-year-old male who traveled to Switzerland and Austria, and then a 46-year-old male who had traveled to Italy. Now the patients have now been informed, and their contacts are being traced at this moment, and so the doctors are managing the patients, and we will give you more details if there's any new developments at this point. But I must also say, because at the time we're reporting in the context of what happened since the last report and where we are now. I need to point out to attention that there are more positive results, but these are still being verified. So we will not give you any details right now until they are verified, and verification means quite a number of things. Firstly, it means that we need to make sure that the test, the original test, is verified in terms of the technical laboratory requirements, and so that when we come back here, we are certain that the test was not a false positive and so on. I think we have experienced that now on 2 occasions. It happens every now and again. There's a percentage of what you would call those false positives that or indeterminate results. So those things will happen, but that's not a big issue. We just want to say that that's one issue that's being worked on. Secondly, before we announce the result, we try and give a sense of a profile of the patients that have been found to be positive. And the issue really is to establish the possible source of the infection. And in this case, we have indicated that so far, all the patients that we have reported who are positive for coronavirus have actually been travelers, so they would have imported the infection from another country into our country. Our role is to make sure that we limit the spread of those who have come from outside.